Hey guys, it's Kay back again today with another CCRN PCCN question. So today we have a patient that presents with chest pain and ST segment elevation in leads 2, 3, and AVF. Right-sided ECG shows ST elevation in V4R. What initial therapy will the patient receive? A, nitroglycerin infusion, B, fluid bolus, C, a beta blocker, or D, diuretic therapy. Think about that for just a second. Now we know 2, 3, and AVF are leads that look at the inferior wall, yes? And we also know that the inferior wall is supplied by the right coronary artery, or RCA. So whenever you have an inferior wall MI, you keep in mind that about a third of the patients with an inferior wall MI will have also infarcted their right ventricle, in addition to the inferior surface of their left ventricle. And so with every inferior wall MI, you really want to do a right-sided ECG. And what you're wanting to identify there is right ventricular infarct. That's why you really hone in on, you look at V4R. If the ST segment is elevated in V4R, that tells you that you have a right ventricular infarct in addition to a inferior surface of the left ventricle type infarct. And at the end of the day, what that means is this patient probably has a very proximal right coronary artery occlusion. The chances for arrhythmias much higher. And of course, the likelihood of right ventricular failure is higher as well. Mortality is also higher. So the answer here is keeping in mind that the right ventricle is stretchier than the left. We're going to give fluid, right? We're going to give fluid in order to load up that right ventricle. We always find ourselves, on the right side, we load it with fluid. On the left side, we unload. When the RV is involved with an inferior wall infarction, boy, they really do a whole lot better if you can give them a fluid bolus. They usually frown on nitroglycerin infusion because it decreases preload and it dumps their pressure in a very big way. Beta blocker, again, will dump their pressure, and they sure as anything don't need diuretic therapy because we want to load that right ventricle, because the greater the stretch, the greater the snap. Remember that Starling's principle. And the RV is really stretchy, so it seems to really respond well to fluid. So that is our answer, B, fluid bolus. If you would like to kind of test your knowledge, you can head over to CCRNchallenge.com and grab onto the mock CCRN exam that I just finished writing. It's free. You can just use it in order to determine where and what issues, what types of things that you need to spend more time studying on before you sit for either the CCRN or PCCN for that matter as well. So you have a blessed day, and I'll see you again tomorrow. Bye-bye.